Hello and a very warm welcome, viewers. You're watching the brand new edition of India Fights Back with your host, Kriti Mishra. The World Health Organization has said that any COVID-19 vaccines it has authorized for emergency use should be recognized by countries as they open up their borders to inoculated travelers. In its aim to restore travel across Europe, the European Union said in May that it would only recognize people as vaccinated if they had received shots licensed by the European Medicines Agency. Although it's up to individual countries if they wish to let in travelers who have received other vaccines. And for deeper insights on this, I'm joined by very eminent guests on the panel today. Joining us on the program, Mr. Ashok Sajjanhar, former ambassador, and Professor N.K. Ganguly, former Director General, Indian Council of Medical Research. Welcome to Rajya Sabha Television, gentlemen.
Thank you.
And Ambassador Sajjanhar, coming to you first. What is this debate that we're hearing about vaccine passports?
Well, vaccine passports, because the world has been affected by this pandemic for the last more than 1.5 years now. And all the countries would like that when people are coming from outside, that they are suitably inoculated, they are appropriately vaccinated, because they would like to make sure that their own population is preserved and safeguarded against any of the disease that might be coming with the travelers. And I think this has become particularly acute. The whole issue has become particularly acute and very, very serious because the coronavirus has been mutating very rapidly, very fast. So it is not known what is the strain, what is the variant that different people might be carrying. So we have a number of vaccines that are on the platform. They are come onto the world stage. But still there is not total clarity in terms of what is the effectiveness of these vaccines. So some of these countries have started using this, the so-called vaccine passports. And as you mentioned in your introductory remarks, it is the European Union which had said that only the vaccines that have been approved by it for emergency use authorization, that only people with those vaccines will be allowed to enter the country and will be able to move around the country, will be able to travel around the country. Similar sort of procedures have been put in place by some other countries. I think the first one that went on this road, on this path, was Israel, which said that, those who are properly vaccinated, that they would be allowed to come in. But of course, this raises a large number of problems, raises a large number of issues. I think you would also have heard that China has also introduced this. And what China had said is that only the countries which are vaccinated with its vaccines, with Chinese vaccines, Sinopharm, Sinovac, only those are the people who will be allowed to come into the country. So it is a new issue. It is a new subject. Of course, countries are very concerned about who all are able to come in, that they don't carry the virus on them and that they don't infect their own population. So I think we need a much broader consultation. We need a much broader discussion and dialogue on this so that the standards that are evolved are such that they are not discriminatory. Because if you look at it, we have the population is about 8 billion. At the moment, we have about 3 billion or so vaccines that have been administered to different people. And out of that, I think about if you take 3 countries, China, US, and India, we would have consumed about more than 60% of the vaccines that have been used up. And if you were to look at the developed countries, I think about more than 95% of the vaccines would have been administered on citizens of developed countries, which means that developing countries, low-income countries, poor countries, whether it is in Africa or it is in Latin America or it is in Asia, they have not been vaccinated. So this procedure, having a vaccine passport, that is highly discriminatory, and there is no equity in terms. There is a global shortage of vaccines. So first, the vaccines are gravitating towards more prosperous countries, those who have more possibilities of buying and administering these vaccines. And the poorer countries are not able to do that. So, it is creating some sort of hiatus between those which are more prosperous, more well-to-do, the richer, the developed countries, and the others which are not. So I think all these aspects of equity, accessibility, affordability need to be looked into, and some balanced approach needs to be evolved and generated with the cooperation and participation of all countries, rather than each individual country determining as to what it is going to demand, what it is going to ask as far as people coming in from outside are concerned. Kriti.
All right, sir, you've set the pace for this debate and you made very important points there. Let me take that to Professor Ganguly. Professor Ganguly, as Ambassador Sajjanhar said, that this is against equity. It is against accessibility, affordability, and of course, we need more dialogue and deliberation for this. Your thoughts, sir?
India suffers with one more infirmity, that it is now one of the major hub of the medical tourism. A lot of patients come from different countries, particularly those countries who have not been vaccinated, like Afghanistan. Some come from Baghdad and other places. So they have not been vaccinated. And India, and from Africa, a huge number of medical tourists come to India, and there many of our tertiary hospitals, 60% input is from these countries. So this is the issue, main issue. So there is no equity in these, and India could make a bilateral agreement with these countries and can decide on that. But there is one major issue in this, that the virus travels with the people, and they travel. You just take the world map of airlines routes, and you will find that they travel, and some countries travel more than others. United States was the highest of the peak, European Union, Chinese and Indians. These are the countries who travel most, and these are the countries who actually China spread it to Europe and US, and then Europe spread it to US, and now the Indian variant has gone to almost all the countries, or 90 countries, and the plus has gone to 20 countries, 90 to 20 countries. So under this situation, this is the hazard index. People are very wary that who should travel from which place, and so that the lockdowns have been eased in many countries. The mask requirement has eased in some of the countries like United States. So people are wary that people from unvaccinated arena will go there. And like Tokyo Olympics, if you are not vaccinated, you can't go. So these are some of the things which are in place. So, but how far it is true and how far it is true in the current context? Say, for instance, initially the Germany and some European countries created a green passport of those who had antibodies. Then they knew that not all antibodies are neutralizing and not all antibodies work, and you need a concentration, which is very difficult to determine. So that was revoked. So now in the initial stages, the Pfizer, BioNTech, and Moderna vaccines, for which the largest data was available, they showed that not only it prevents death, it also prevents severe infection, and it prevents transmission of the virus. It was not known immediately, but later on data came that it prevents transmission of virus from one person to another, and even the asymptomatic stop transmitting. So that actually reassured people that if you get vaccinated, you will be okay.
Yes.
So So what happened now, that there was something which is very odd which has happened now, that all these countries who have a very high vaccination rate, like Israel, like Russia vaccinated almost from entire of its population, eligible population. China vaccinated, and Israel vaccinated, UAE vaccinated, US, European Union. In all these places, the surge is happening again in certain areas, and
Yes.
these surges are really worrying, and these have happened because of the variant. So variants are actually infecting those who are vaccinated. Although they are not dying, most people, 98% of those who are dying are not vaccinated. But there is no guarantee that these guys who have the variants or variant pluses will not transmit this. The current data says that. So
Yes, sir.
these things change from time to time. So now anybody who is coming from US to India, the vaccine certificate is not the mainstay. They have to carry a 72 hour before RT-PCR test with them. Only then they will be allowed.
Yes, sir.
So RT-PCR test is still has becoming a very important part of this. Now vaccine normally in the global arena, vaccine which are WHO pre-qualified, these are normally allowed. And these pre-qualification is a long process, and WHO, as you have known, has pre-qualified Pfizer, BioNTech, Moderna, J&J, Sinovac, Sinopharm, etc. It has and the AstraZeneca. These they have pre-qualified. And European Union has also pre-qualified. Some of them, they have also pre-qualified. So these pre-qualifications make eligible for those who are vaccinated to go to those countries. Now,
Absolutely, sir. Yes, sir.
pre-qualification depends on two factors. First, it should be GMP produced. Second, the trial should have been done on the global norms which have been set up by WHO and US FDA or EMA, etc. These are some very mature regulatory authorities, and they have set up the norms. If you have followed those norms, it is easier to get that. If you have made shortcuts, countries have made shortcuts because they needed vaccine early, so they had made some shortcuts. And if you have made that, when you put in an application, it will be difficult or delayed for getting that. So one of the things which have now people are accepting, that if you have a live data, that if you have given it to a large population and you have collected enough data for safety and efficacy, they are admitting that particular data set also. It was very strange that AstraZeneca vaccine was qualified and they were not qualifying Covishield. So bilateral, as Ambassador Saab has said, bilateral agreements could always be made between the countries. So India put in some screws
Yes, sir.
that we will do reciprocate. If your people come and they come for India for trade, you will have to go to quarantine. So they relax because for the Covishield, because Covishield is the same as AstraZeneca, and this has been approved. The Covaxin has also been approved by one of them. But
Yes, sir.
now
That's a very interesting point that you're putting across, Professor Ganguly. Let me take that to Ambassador Sajjanhar. Sir, as India toughened its stance, Covishield is now eligible for travel to Austria, Germany, Slovenia, Greece, Ireland, and Spain.
Yes, indeed, Kriti, you are very right. That these are all members of the European Union. And I think, as you had mentioned in your introductory statement also, that EMA, the European Medicines Agency, right at the beginning had also mentioned that in addition to these four, if any of the countries wants to authorize and approve any other vaccines, then of course they are well within their right. And, you mentioned this 7, 8 countries which are members of the European Union, and there are two other countries which are not members of the European Union, that is Iceland and Switzerland, and they have also approved. And don't have the slightest doubt that as far as Covishield is concerned, it is going to receive the authorization from increasing number of countries. And also we know that the Serum Institute of India, Mr. Adar Poonawala, he said that they have already given application for approval of the Covishield to the EMA, and hopefully within the coming weeks, we should be able to get that. We also see that Estonia, which is an important Baltic state in Europe, that has approved all Indian vaccines that are being used, which is including Covaxin and including Sputnik V, which India is using. And of course, going forward, we are going to be using some other vaccines also. I think as far as Covaxin is concerned, we still do not have the authorization for Covaxin from WHO. So, we don't have that stamp of approval from the WHO. I think once Covaxin gets that, because, it's been a little delayed in terms of submitting its, phase 3 trial data and, some of the other information that WHO needs before it authorizes this. So Covaxin should also be on, a very stable platform. But I would imagine, there are 2 or 3 problems with these vaccine passports. Number one is, the fact that if anyone who's been vaccinated, who's got the double dose or whatever is the requirement of a particular vaccine, if she or he has got it, then, they might feel quite relaxed and content that we are now vaccinated, we are protected against the virus. And they might not pay as much attention as they should to the COVID appropriate norms and behavior, masking, maintaining safe distances, maintaining, sanitization and personal hygiene, etc. So they might get a little lax as far as this is concerned. And this is something that is not desirable at all, because as we have known and as Professor Ganguly also mentioned about it, there are newer variants that are coming. We started with alpha, then beta, then gamma, then delta variant. We are not naming them according to the countries. Of course, because, that is what the WHO practice is, that, you don't stigmatize any particular country by naming it from where it has come. So Delta variant, that has been a very potent, that has been a very virulent and highly transmissible variant. And now we see that, there is a Delta plus variant. So, these mutations will continue to take place. Now, whether these vaccines are equally effective against these variants also or not, that is a big question mark. I think more study needs to be done as far as this is concerned. And, the third aspect would be as to for how long would this vaccine really be effective? If I have taken my double dose around the end of April, how long is it going to protect me? How long will it be effective? And the final point that I'll make here, Kriti, is on this, that, there are vaccines like Sinopharm and Sinovac that have been approved by the WHO. These are the Chinese vaccines. But then results, whether, it is UAE, it is Bahrain, it is Seychelles, it is Mongolia, it is Brazil, it is Indonesia, all these countries where these Chinese vaccines have gone, they have not been particularly effective in, what is the vaccine supposed to do? Number one, so that you are not hospitalized, that it doesn't lead to, any fatality or something. So what the WHO says that anything that we have approved, anything that WHO has approved should be given, should be put on whatever the green pass or the, the vaccine passport. I think that needs also to be looked at. And that is why I mentioned that, we need more dialogue, more conversation to come to a universally accepted standard as to what vaccines can be accepted.
Sir, I'll borrow that phrase from you. As you said, that universally accepted standards, we need to evolve that. Let me take that, Professor Ganguly. Professor Ganguly, this selective restriction by nations, they are undermining confidence in life-saving vaccines that have already been shown to be safe and effective, at least till now.
Like Kriti, the global nations, including India, created rules like you have to go through preclinical phase 1, phase 2, and phase 3. And there were the duration and numbers which were needed. In the phase 3, normally numbers were needed 40,000 to 60,000. And there was another rule which was made, that in the phase 3, if you need emergency authorization, you should at least 2 months follow-up should be needed for the safety data gathering, because many times there are delayed safety issues which come up. So some of the countries and vaccine manufacturers didn't follow it because of the local needs, and they were given some kind of a relief, that because we needed vaccines, so we will use them. But then when they go for a global approvals, they will have to produce the data. If they don't produce the data, they won't get global. At least the live data, which I mentioned, they need to produce. However, then one point which Ashokji said, and I want to emphasize, that this was a dynamic thing. Like many vaccines were used in the trial in multiple countries, in Brazil, in South Africa, in China, many places they were tested, not only in a single country. Actually, Covishield also, AstraZeneca did it in multiple countries, and those data were available to look at. So that is normally a norm for the global approvals. However, what we see now, that Russia got the Sputnik, and Russia is having a surge, large surge. One of the biggest surge which is happening is in Russia, and they have got the vaccine. And the same way Brazil, when they got the Russian vaccine, they had to stop. The effectiveness was in the Brazilian state around 40%, for 50%, and the margin is this. So these may change, the same as a Chinese vaccine. If they don't have the desired effect when they go globally and people gather data, things will change, and then all hell will break loose. That what do we do now? And at that time, it will be important that we take a booster. Like we will have to take a booster. There is no doubt about that. And some booster data is already available. Like with the Covishield, the second injection UK gave was in some subjects on the Pfizer BioNTech. Now Cipla is getting Moderna in India. Yes. One of the things I will do, that as soon as I pass 6 months of my 2-dose vaccination, I will go in the open market, buy Moderna vaccine, and will take a shot, because that will be very good idea and protective. There is one more problem which we need to really handle it absolutely. That yellow fever was never in the Asian subcontinent. 13 Chinese came back from Angola with yellow fever. But everyone in the world, India, Asia, they got absolutely scared that if we get yellow fever, we are gone. It will be much worse than COVID, because we will die like flies. Yeah. So it was found that they had got a false vaccine certificate and they were not vaccinated. In India, there are 2 or 3 episodes of false vaccination certificates have come up. So we need to really take steps that the vaccine certificates which we are taking are really respected. One more glitch is happening, and this glitch we need to solve. That although a person has taken 2 shots of vaccination, some clerk in the entry did error, and that has not been entered. And although you have taken 2 vaccine shots, and 2 vaccine shots are necessary, we now know that 1 vaccine shot doesn't work. So you will not have a certificate, and then you will be in trouble. So we need to look at what are the things which are happening and which will need course correction, and should correct them. Like if I have a wrong entry in Aadhaar card, I go and this is corrected.
Yes,
so if I have a proof that I have taken 2 vaccine shots and somebody did an error, I should get that certificate corrected. So we need to look at all the global things, all the glitches which could happen, and correct them.
and find solutions for them. Absolutely, sir. But I just have last 60 seconds on the show. Ambassador Sajjanhar, your closing comments. I remember that in a daily press conference, MEA spokesperson Mr. Arundam Bogchi said that India would favor discussions on the subject of vaccine passport with greater focus on vaccine equity. How do you read this statement, sir?
Absolutely, I'm in full agreement with that. We need to have discussions. No global agreement can be sort of, imposed by one country or one set of countries. And, let's face it, it's a win-win situation. The global economy has suffered greatly as a result of the pandemic, whether it is airline travel, whether it is hospitality, whether it is hotels. So people who are going as students, as businessmen on tourism, on pleasure, just take the case of Europe, meaning they would want people from India to come there because Indians are big spenders. They are law-abiding tourists. So, they would like them to come. So it's a win-win situation for both sides. And that is why all these countries need to come together, put their heads together and find an equitable, balanced, easy to implement agreement on allowing people, whether you call it vaccine passport, green pass, whatever it is, but it should be equitable, it should be non-discriminatory. Kriti.
It should be equitable and it should be non-discriminatory. On that note, thank you so much for joining us, Professor Ganguly and Ambassador Sajjanhar. Well, viewers, that's all we had for you in this edition of India Fights Back. But before that, let me remind you once again to stay safe from the coronavirus pandemic. Remember to wear a face mask and wash your hands and face regularly, and ensure that you maintain physical distancing whenever you're stepping outside. Well, these simple precautions are all it takes to defeat this pandemic. Take very good care and goodbye.